show. So thanks, guys, for coming on.
Yeah, and we have it's like a virtual public health party right now in the KUAM News Zoom room. We have Tom Nadeau, who's the big boss over there in environmental health. We have Malou, who's also a big boss. And we have Janella, the new PIO over at public health. And do you want to kind of just, we'll ask Janella about the quarantine and stuff, and then we could get to the environmental health stuff. How you want to do this?
Yeah, we can start there.
Yeah, so
There was in the JIC release over the weekend. It was some clarification on guidelines for quarantine. Is there a change?
and we'll bring on Janella for this. So Janella,
Yeah.
yeah, if you could clarify.
Yeah, hi. Good morning, Chris
Good morning.
and Bree. Glad to be on your show. I think this is my first time being on your show.
Welcome.
So happy to be here. Thanks for having me.
Our pleasure.
Thanks. So, so we issued Rev 7, a revision 7 to our quarantine guidelines. There are some changes, and this is applicable to the new quarantine guidelines for, the new, what do you call this? I'm at a loss for words here. This is for the executive order.
Right.
So what changed is because the executive order is until September 11th, all incoming travelers are subject to a 14-day quarantine, with the exception of a few, and that is for you have to meet certain criteria, and in order for you to be able to, go to proceed to home quarantine or be approved for release to approved lodging, you have to meet certain criteria. So those are the main changes to the new quarantine protocol.
So what exactly are the changes? Is it just for different classifications of people? Like I think it said something about like medical professionals, military.
Right.
Is that it?
But workers, medical professionals. So those are the new changes. Otherwise, you would be subject to the full 14-day quarantine at a government facility. So those are the main changes. Previously, what we had was if you came in and you had a negative test, you can proceed, and you came from a low-risk area, then you can proceed to home quarantine. But now, because of the increased positive cases that we've been seeing, and because we're under PCOR 1 and a stay-at-home order, then you have to go straight to government quarantine for the full 14 days. And so we had to issue new guidelines just so that there's no confusion. People understand when that they come into Guam and they're traveling in, then they have to go to the full 14-day quarantine. There's also a provision in there that states that if you're coming from a jurisdiction or a country or an area that has 0 positive cases, which these days it's really hard to find an area with 0 positive cases, then you can proceed to home quarantine.
Wow.
There's something here on the Guam Hotel and Restaurant Association, their I guess their agenda for their meeting next week, and it says the Guam COVID Alert app. Is this something new or we've always had it?
So if you've been to our website, guamcovidalert.guam.gov, you'll see on there it says launching soon, September 10th. That's when our so we have a press conference coming up on the 10th. That says coming Thursday at 10 a.m. It's a contact tracing app. I don't want to give too much details because I want to give the governor and the lieutenant governor and Public Health Director Art San Augustine the opportunity to be the one to unveil all the details about this app. It's a really exciting app. It's an exposure notification app. But basically what it is, it's a contact tracing app. And the gist of it, and you can actually, if you visit the website, it has a couple of videos in there that just give you the basics of the app. So what it does is it gives you a notification if you've been exposed to somebody who's been diagnosed with COVID-19. But when on the press conference date, we'll give you all the details about how this app works. And the idea behind it is, everybody who has a smartphone, if you want to buy into this, if you want to volunteer, we encourage them to download it. But it won't be available until the 10th. And it's really a neat app. And the key to it is privacy. So, we don't want to scare people into thinking that the government is watching you. It doesn't track your location or anything like that. But again, I want to wait until the 10th because I want to give the governor and lieutenant governor and the director the opportunity to be the one to, give the details about the app.
Right, and you can get that.
There are, several states that have already launched the app in their states, and Guam would be the first territory to adopt this app and launch it.
There you go. And Jay's popping up. There's a site here, Guam something or other COVID
No, yeah,
alert.
Janelle, we're showing people the
Yeah.
screenshot, and we can share the link in comments just so people can prep themselves. Is that cool?
Is this for everybody?
Yeah. Guam
And
COVID alert. Sorry.
is this for everybody and anybody to download this app? The
Yeah,
Guam-
yeah. So on the 10th, it'll be available on the Google Play Store and the App Store. If you have an iPhone, it's on the App Store, and if you have an Android, it's going to be available on the Google Play Store.
Okay.
Okay, thank you,
So
Janelle.
we're still refining and on the 10th, it'll be available for download.
Cool. Let's move over. Thank you for that, Janelle. I appreciate it.
Sure, no problem.
And we'll move over now to Tom and Malou, the Division of Environmental Health. And good morning, Tom. Good morning, Malou. Thanks for joining us on the link. It's the breeze.
Thank you. Good morning to you, Sabrina and Chris. How are you guys doing?
We're doing okay, Tom, but judging from your hair, we're kind of in the same boat here. No haircuts during PCOR 1 lockdown. I'm kind of digging mine, though.
You know what? My wife loves it too, so maybe I won't cut it for a while.
Dude,
My
you
wife
just
thinks
took
it-
me back to like high school. Can you do the feather that, Tom? You can feather that, right?
Actually, I can.
Yeah,
Actually,
see?
I can feather very well.
Bringing it back, guys.
Would you like me to try it? No, I'm kidding.
No, yes, yeah. So good morning. Thanks for joining us, and we'll just get right into it. So we had and we'll start with the COVID inspections. Can you give us a little more info on these COVID-19? I don't know if that's what they're actually called, but these inspections that you do of businesses and establishments to make sure that they're COVID compliant.
Sure. So through the governor's executive order, the Department of Public Health, we've been tasked to enforce the COVID mitigation measures that's been required via the executive order and our public health memo, guidance memo. So we meaning Division of Environmental Health, were specifically tasked to implement the enforcement of the requirements. So we've been visiting various island businesses, whether through complaints or routine inspections or concerns. And we looked at, Malou, you might want to help me here. I think the total number was like over 1,000
Check.
businesses since the emergency was declared. Is that right, Malou? What was the total number? You know?
We visited and inspected 1,072 establishments. That's including health regulated and non-health regulated, but a total of more than 3,000 establishments that we visited from March 17 to September 6.
Right. So, yeah, you're right, Marlo. I'm sorry. I'm looking at my number here. Over 3,000 businesses have been visited since the emergency declaration. But that does not mean all 3,000 were inspected. Many were closed during our visits, or they're in compliance. So we only inspected those that are actually found in non-compliance, or there was a complaint.
What do people say when they call up and they make these complaints to you guys? If you could just maybe run the gamut of the snitchery that goes on.
Well, I wouldn't call it snitchery. I would just call it people who are concerned
Right.
of the non-compliance by the public or the businesses. And it varied everything from lack of social distancing, not wearing masks, or to allowing, in this recent cases, how certain businesses are allowing customers to actually come inside their establishments, especially if they're a dining facility, when that's not permitted, or
Right.
it's a business that's not authorized to operate during PCOR 1.
Right. So let me ask you this, because I saw something on Instagram, so right now only essential businesses are allowed to operate. But what about like a furniture store, right? So we get these tips about this furniture store in Agatna that's open. I mean, I'm looking at their Instagram right now, and they're talking about, oh, they sold out on this piece, and this you could get this couch for how much? So is it like a furniture store? Are
Well,
they
they are-
authorized to operate? if they're
Yes and no. They may if they are certain authorized or essential goods like mattresses and things that are needed for daily living. But primarily like mattresses and maybe even desks. You know, if you need it for distance learning.
yeah.
You
What
know,
if, what if I
we
need
are trusting the
Tom?
businesses to.
What if I need
Yes.
today's featured promo, which is an Ashley Luden rocker recliner, regularly $499, now only $249? Is that essential, really? Come on, really?
it
Is
just
that
seems like
come
it's-
on?
Well,
a lot of gray area
Well, you know,
here.
and this is where we are relying on the businesses.
I'm snitching. I'll
Other
send you the
businesses-
link.
to play by the rules, if you will. I mean,
Right,
we
yeah.
issued out a guidance document, and we must remember that this is a stay-at-home order. You should be out on the road or out in the public only at necessity, whether to buy basic goods, certain required items, basically necessity of life. I mean, outside of that, everyone should be home or going to work if they're authorized business to operate. But I understand. I mean, you know, the rule of thumb is if your businesses has merchandise 80% or more that's deemed essential, then you may operate.
Right.
Okay,
So
but that's a very difficult for us to assess. So we are trusting the businesses to do their part and to ensure that they meet and comply with that requirement.
Right,
But, you know, we give them the benefit of the doubt, but we will do an inspection if we feel that that there is a violation in place.
So what happens? I mean, if they're violating anything, I mean, so what do you guys do?
Well-
You just go there and say, oh, you shouldn't be selling
You go in-
recliners. Mattresses, okay. Recliners, no. I mean, so what happens? That's it?
Okay, Malu, you want to take that one?
Okay, if we found that they're in violation, we cite them and it has to be corrected on the spot, or we give them 24 hours to correct the violations. Then our policy is if it's a repeat violation, we'll cite them again and we'll refer them to the AG's office.
have we reached
If I
that
can
point?
also add to that. Yeah, well, let me add to that also, Chris and Sabrina. We are bound by existing law regulations that's in place. There is no penalty specific to COVID for public health. Well, we're using what's called a public nuisance provision in our existing law. And that's anything that's deemed dangerous to life or injurious to health. So we use that particular citation, but we are limited by what we can do or what's allowed or what's the enforcement specific to public nuisance. And we can't simply pull the business license or pull away or take their sanitary permit. So we're bound by what the existing law allows us to do. So we gave them notice, and if there's a repeat violation that we feel that they're not complying in good faith, we'll forward that to the Office of Attorney General for possible criminal prosecution if necessary.
Right. So, and on that point, how many have you forwarded to the AG's office, if any?
Right. At this time, we all the business that we visited so far, they've complied. So we have yet to forward any. And as Malu mentioned, Malu, correct me, unless it's something they cannot absolutely do, like have a plan, develop a plan for their specific business, all business that we visited so far, they corrected all the violations on the spot. Am I correct, Malu?
Correct.
Okay.
I wanted to ask
So
about.
to answer your question,
Okay.
There's only a few that's not corrected on the spot because it takes time for them to comply with the requirements, just like the pandemic plan. So
we
we
gave
need
24
them
hours.
24 hours for that.
Right. I wanted to ask about a specific case that we had saw in one of the reports that we got, and this was with the church in Assen. Was it Calvary or Calvary? Man, I always mix them up. But so anyway, the report said that they weren't using the masks, no social distancing, and if you could just take us to that day, responding to that specific call. Was it you, Tom, or your staff?
Yeah, it was our staff from Division of Environmental Health. I can't recall, Malu, if it was the actual complaint or it was a routine inspection, but we did visit the church in question. They were non-compliance. Well, there were definitely violations observed, and we gave them citations. And if I'm not mistaken, they did comply the following week when we, I think, did a spot visit or made inquiries. Malu, was that correct?
Yes, it was a complaint through social media. That's how we were informed because of social media, and it so happened that, and that was the weekend. So our health inspector went there and addressed the complaint.
And so what's
So
it
it was
like?
confirmed. The complaint was confirmed.
Right,
Yeah,
right.
it was confirmed. And the following week, we received an info from one of the person that attend the church that the pastor is complying with the executive order.
So what they did? They living in Yokoi's cave. They didn't know that you got to wear masks and you got to social distance.
I think it also was over like the limit of.
Right. So these guys were just striking out on all of the measures that are designed to protect us from the spread of COVID. So how did your inspectors feel when they come onto this scene, and for the most part, we're all doing our part, and you come into this scene and it's jam packed, nobody's wearing a mask, just
I mean, is that what your inspector saw, that it was jam packed, that there were so many people? I don't know what they were doing. Was it a car wash, or what was happening? Were they actually in a service and all these people didn't have masks on?
Malu?
Anybody know?
I don't understand. Can you repeat that again?
Was this
I
a
didn't-
service? Were they in a service when the inspectors arrived
right.
and noticed these multiple violations?
Okay, yes, when the inspector arrived at the site, they observed that they're not practicing social distancing, and a few of the attendees were not wearing masks. So what happened is they wrote their inspection report and cited the establishment, and we called GPD to go to that site and disperse the congregation.
Wow.
Why did GPD have to be called? Was there some sort of disagreement or confrontation that would necessitate
Yeah.
GPD being called?
Right. If you ever read the executive order, there is a provision that, in addition to authorizing public health and DRT to enforce the provision of the executive order, it also allows us to get assistance from GPD. And by policy and practice, whenever there's a large congregation of people, we ask the assistance of GPD, just by practice, to ensure the safety of everyone involved. It's not our intent to have any confrontation with the people we regulate, or that we when we enforce the provisions. It's just there for safety of everyone.
And so they dispersed. That must have been a crazy scene, man. What was that scene like?
I was not personally there, so Malu, maybe.
Right,
Malu,
Malu,
maybe
what
can
was
help
that scene like? I mean, just the optics,
right
right?
when-
The optics of the
No,
police
right when they
breaking
issued
up.
the citation,
Go ahead.
the inspector left, and GPD took over. Because that was the instruction. If it is a big crowd, we call GPD, and we leave, and GPD will take over.
How big of a crowd was this?
Say that again.
How big of a crowd
What
was
was the
this?
size of the attendance?
Yeah.
How many?
Yeah.
You
Yes.
said? I think there's about more than 30. Looking at the picture.
Oh, can we get a picture?
Is that an official request, Chris?
Yeah, that is an
Yeah.
official
Is that official
request.
FOIA
Please don't
request?
make me send a FOIA. It's a verbal FOIA.
Well, all our inspection reports are public information,
Right.
public document. It's
Yeah.
available, and any accompanying document that goes with that can be provided. So we'll definitely look into that, Chris.
Thank you, guys.
I'll
Thank
take
you.
note of that.
Right. Hey, and then I wanted
Thank
to
you.
ask, because you're describing a scene that if I'm an environmental health inspector and I'm coming onto the scene, or any scene with these COVID protocols, especially given how in a lot of instances with certain sectors of the community, the COVID, it's just so politically charged. So I feel for these inspectors to come onto this scene where, like you said, it's such a big crowd that they have to get, the men and women in blue involved. So what's the feeling with your inspectors? Are they good out here in this COVID environment, or is there any anxiety or fear or?
Well, first, it's our job to enforce the requirements, not just for the COVID, but as a regulatory agency, we are tasked to enforce rules and regulations and statutes that govern particular operations, whether it be health regulatory establishments or in this case, any business that's governed by the COVID requirements. Of course, there is always inherent danger involved, but it's all an approach. And generally, people don't, their understanding of our responsibility, though they may not agree to the requirements. It's rare that we actually encounter a situation where GPD is called, but we do so currently only because just to ensure the safety of everyone. And I say everyone, not just our inspectors, but everyone involved who's on premises. But our staff, they are trained also diffuse any confrontational situations. In fact, they are to avoid any and all confrontation if possible. And if it gets out of hand, of course, we call GPD.
Right.
But currently, it's just practice for now to
Right.
notify the man in blue, as you said.
So have you guys hired more inspectors? Because I've noticed when I get the releases on the inspections, the sanitary inspections, and then you have the separate release on the COVID inspections, and it's quite a significant number of inspections. So I know in the past you guys have had such a shortage in staff that you weren't able to keep up, but it seems like as of late there's a lot of inspections that have been taking place. So have you guys increased your inspectors?
No, we still have the same number. Actually, we've lost and we're losing some inspectors, but we focused most of our resources in the COVID response. I mean, our day-to-day operations has generally stopped or it's on standby. So we're able to direct these resources, primarily human resources, to enforcing the COVID requirements. But it's a challenge. And our staff is out day and night, every day, even on weekends. So even yesterday we were doing inspections. So and we understand the need to to respond to all these complaints and concerns we receive from the public.
That's actually a silver lining that you guys have been able to use personnel who would otherwise be grounded to go out there and inspect these places. I wanted to ask because you guys took some flack. I saw some on social media with the ServSafe certification, and this is going back to when I think the bars were open. You guys had pinged some people on that they didn't have anybody with a ServSafe certification on site, or if you could provide a little more clarity on that.
Sure. All food facilities, or specifically all eating chicken facilities, they must have an individual, a manager on staff who possess a manager certificate. And that could be a ServSafe certification or any other recognized certification. This is certification testing to the food safety knowledge of the individual. And this has been in the book since, well, it was 2016 or 15 or so. So it's not a new requirement. It's something that's always been required. It's just that when we're doing the initial inspection and we're going primarily at night, business that were open primarily at night were bars. And that's where a lot of our complaints were coming also about. So we had the opportunity to inspect bars, and unfortunately, whether through ignorance or just not understanding or blatant respond, we're not really certain. A lot of them just didn't have a manager with a manager certificate. But I like to say for every one that we found, there were like 3 others that were in compliance. So it's not that most of them or majority of them were not in compliance, just that a few of them were not in compliance.
And speaking of the bars, that was one of the first, or may have been the first, that the governor during, was it their first, when she restored us back to PCOR 1, she said bars closed, and you guys were going to review the rules and regulations and come up with perhaps new guidelines. Has that transpired already? New guidelines for bars and for bars?
Well, currently bars are prohibited from operating during current PCOR 1. Right, and we did issue a guidance earlier when they were allowed to operate. There were restrictions in place, and that we still have those regulations in place. But unfortunately, because of the current PCOR 1 status condition, bars and a handful of other businesses are not allowed to operate.
No, but I thought when the governor said shut them down, there was supposed to be a review of those guidelines to see what else needed to be done to, I guess, improve them.
Oh, yeah. So our current guidance and past guidance, they're always constantly being reviewed and when necessary, updated. Right now, the focus on PCOR 1 condition. So Sabrina, to answer your question, I would not be surprised when we out of PCOR 1 and start relaxing the restrictions that we'll be looking at bars and other businesses as well to see where we can improve in ensuring that the compliance with all the businesses on the island, including bars.
I wanted to ask because we had Christine, and then I noticed that a lot of the different business organizations, they say this, that when you look at the spread of COVID, I mean, yeah, we've had, businesses come out and announce a positive, but what these groups say is that the positive cases are really coming from the community spread. And when they go in and they look at the protocols that you guys at Environmental Health lay out, that they're all being followed for the most part by these businesses, and they say, oh, so that kind of shows that the risk of getting COVID from a business is very minimal, since the cases that we're seeing with these businesses are coming from people who catch it out in the community and then maybe go to work. That being said, do you feel like your division has been successful in checking on these different protocols and doing the inspections and making sure that people are dotting their COVID I's and crossing their COVID T's?
Well, that's a tough question, and I wish I can give you a clear-cut answer to that. What I can say is that we've been responsive to all complaints. We've done more inspection than we've ever done in the past because we have the current time and resource to do so. I think you would probably have to ask my colleague from the Division of Public Health to answer that question. They're on top of more of the data in terms of the cases and those data that's related to that. So maybe they could best answer that question.
Right.
I can only answer for Division of Environmental Health.
Thank you, Tom.
Accomplishments.
What are we looking at, though, long term? Because it's clear that the Division of Environmental Health, I mean, you guys are just as much on the front lines as, I guess you could say, the Guam Fire Department and Guam Police Department. So long term, are we looking at giving you guys more resources, more people, training more people to contain COVID and just disease in general? Because
Sabrina, thank you for I thank you for recognizing that we are somewhat in the front line as the others. My staff are out conducting inspection, interacting with the public, but our staff is they're provided the knowledge and maintaining and allowing them to do inspections, so maintain and implement the necessary mitigation measures so we protect ourselves as well and the public, the people we interact with. So we give them that protection in terms of the information and the whatever personal protective equipment that's necessary. Where do we go from here? Well, we'll continue to abide by the executive order. We'll continue to do many inspections as possible as resources permit. We hope to get additional staff to assist the current inspectors so we can do more inspections and respond more timely. Eventually, the pandemic will end, and we'll have to continue doing the routine inspections of all the health-regulated establishments. We're optimistic, but historically, our division has always been challenged with the lack of personnel.
Right.
But we always do our best.
Sure do, Tom. I just want to ask, so when we talked in the beginning about the public, right? So because you guys don't have boots in the ground in every business that's open, we're relying really on the public for a lot of this enforcement and for the businesses to just, do their part and play by the rules. So if I'm a member of the public, what are some of the things that I should look out for when I go to pick up my curbside or when I go to someplace like, the bank or whatever, places that are open? What do I look out for so that I know, oh, that's not right, I better call Tom and Malou?
And who do you
Yeah. And then who do we call?
Sure.
What's the
Malou,
number?
I'll
And all
let you
that stuff?
Sure. I'll Malou answer since she leads the inspectors and very familiar with the various violations and complaints that we get.
Okay.
But the number that we have, our phone number here at the Environmental Health is 300-9579. And also our email is dphss-deh@dphss.guam.gov. So that is our email and is our phone number. And Malu, you want to answer Chris's question as to what are the things the public should look for when?
These are the
Oh, go
things that we look for when we conduct the inspection, to make sure that the establishment or the management is enforcing mandatory wearing of masks, also enforce social distancing, posting signage of face masks and social distancing, and also have a policy in place for frequent cleaning of all surfaces, maintain the authorized occupancy rate, and adhere to the authorized number of social gatherings. So if you see congregation outside establishment or a facility, then that is in violation to the executive order. That's the most number of complaints that we receive is people congregating or not complying with the social distancing. So if there's a lot of cars parked in an establishment or a business that not authorized to open, that's when we get down and also check if they are complying with executive orders. That's how we determine if we have to get down and conduct inspection, is if there are a lot of cars parked in a business or people lining up. Then even if we don't receive a complaint, we go and check those businesses.
All right. Well, thank you guys
Yeah.
for joining us. Very informative.
Yeah, Tom, definitely informative. Next
Thank
time you
you.
come on, though, you got to comb your hair on the Zoom and get that feather. That we got to have the goody comb, and you got to wear the low top Vans.
You remember that?
Yeah, of
The
course.
goody combs, that's right.
I lived it, Tom. I lived it. And then you got to put the goody comb in the back, and it has to hold
back
your
pocket.
polo.
Oh, my
You have to
goodness.
kind of tuck the tail of your polo behind the goody comb. Okay. there-
Absolutely.
Okay.
Yeah,
So,
tie the bandana.
Chris, we're dating ourselves. You realize that, right, Chris? We're dating ourselves.
oh, that's fine. Thank you, Tom.
All right.
Thank you, Malou.
Thanks,
you.
guys. Stay safe.
Right on. Keep up the good work.
Yep.
Okay, that's
Thank you
that.
very much.
Wash your hands. They know. I don't got to tell them wash their hands. They're gonna tell me like, no, you wash your hands. And
And your thumbs.
yeah. So that was interesting. Very
Yeah.
interesting. Good show today. Some of the takeaways, Sabrina.
Really sad situation over at the Guam Memorial Hospital. I want to say this is pretty high. This is highest that I think we've seen. There's
It is.
51
51.
people